Thank you, thank you. All right. Looks like we're all in there, but I'm pretty sure we can all join, even if we're going through the presentation. So we'll get started. So our first question is, how are you feeling as you join today's session? Are you feeling energized, excited, and ready to engage? Are you already seeing someone in the overwhelmed? Same here. Curious, are you curious, interested in learning, observing? Are you cautious, you're a little unsure, but open to participating? Are you feeling calm, maybe quiet, reflective, taking it all in? And thank you to those who have already responded. Looks like we have a lot of folks in the curious, calm, seeing one energized. Thank you. Overwhelmed, yes. We're in October. We're really wrapping up the year. Curious, so interested in learning more. That's great. Feeling energized. Yes, we need that. Yeah. Personally, I'm teetering between overwhelmed and calm. It's a very gloomy day here in New York City, so yeah. All right, thank you all. Let's move along. So now really more focused on our topic for today. Where would you place your school on the spectrum of readiness to address substance misuse? Are you just planting those seeds? Are you beginning to plan and take action? Are you in the early growth stage? Are you having some awareness, but programs are limited? Are you growing strong? We already have one person there. Initiatives exist and the momentum is building. Or are you fully rooted? Is your school having those strong programs in place and policies? All right, looks like we have, yeah, a lot of planting seeds, just taking flight on that. Early growth, growing strong. That's great. And thank you so much to those introducing yourself in the chat too. All right. Looks like in the lead we have just planting seeds, and that's totally great. That's actually what we're going to chat more about today too. All right. Let's move along to our final question. What questions do you have about substance misuse prevention or today's session as we start off, just to see a baseline where folks are? And this is open-ended, so feel free to add one, two, any questions that you might have. If it's also not loading for you, feel free to put them in the chat too. All right, nothing at this time. It's okay. Maybe as we move along, things will come up. All right, I'm curious to hear what other universities are already doing, and we'll definitely have space for that during the resource sharing part too. Yeah, interested in seeing the presentation first. Totally okay. What risk factors are being addressed to prevent substance misuse? What protective factors are being implemented? So it looks like we're really curious to see what other institutions are doing and yeah, just getting a feel for what's out there. Yeah, it looks like we have a question in the chat. How can this topic be more of a collaborative effort on college campuses? We will also have a Q&A session after our two speakers present, so we'll have time there to see if they can shed some light on this as well. So I'll bring us back to the deck and I'll hand it over to Erica to frame and introduce us.
Thanks, Stephanie, and hi everyone. So glad to be with you today. Really excited. This always makes my week when we do these And I'm thrilled to have guest speakers talking about this really important topic. So we always have new people joining us. So we always like to ground and sort of what we're about and what we're doing together here. But just to kind of remind, in 2023, the Kentucky Student Success Collaborative, or KYSSC for short, partnered with us, the JED Foundation, that we advocate for student well-being and suicide prevention. And we basically were like, let's assist all the schools in the state to think about how do we continue looking at the good work you're already doing and extend resources and improve support and ensure staff are equipped and feeling confident and good in this work to continue to support efforts. So, when we started this, it's been a really tremendous ride with so many people involved in the strategy and the work. We've done a ton, and we'll talk about that in a little bit. But I just want to say, really proud of the work, and a lot of other state systems have looked at what you all have done together and have wanted to join in the effort. So thanks for being here. Next slide. So I know many of you know the JED Foundation, but just in case, it's a good reminder. Again, we are a nonprofit that protects emotional health and prevents suicide for our nation's teens and young adults. Next slide. And we were founded by Donna and Phil Satow. Here's their picture. And in 1998, they lost their youngest son, Jed, to suicide when he was a college student at University of Arizona. And just a sort of a brief story. When the family went to visit the college through their grief and after Jed's passing, they met with the college president at the time and wanted to know why this happened. And the college president turned to them and said, we have still 30,000 students and we have a counseling center. How else can I support in providing a safety net to this college campus? So they took that question and got a lot of experts around the table. They looked at models that have worked to reduce and prevent suicide and started the JED Foundation in 2000. So, oh,
Yes.
sorry, I think so. Okay, just making sure someone's on mute. So at the time, nothing, back then in 1998, we didn't really have a lot of standard processes. Again, looking to just sort of the therapists on campus, if those existed, to support mental health. And we've obviously come a long way. So again, really proud to be doing this partnership. Next slide. So our uniqueness in our approach in Kentucky, I feel we update the slide pretty much every time we speak because we are doing so much together and in unison. But just it's very diverse and really matrix. So we like to just point that out. So we have 6 schools in the state of Kentucky who are actually doing our 4-year JED campus program, and they're listed here. And we have schools who have had joined in different sort of states of time. So it's been really interesting to have them invested in this work, to be talking about the work that they're doing on campus through a strategy lens, but also putting forth voice for our implementation of our statewide strategy. We have had 2 in-person convenings to date. This is our 10th community of practice today. And then we have the 16 Kentucky Community and Technical College System administering the Healthy Mind Study. So they've done the first baseline study, and we'll do the next one as well. Doing 3 communities to practice today and 8 task force meetings. And together, as both sort of systems, if you think about it, we've collectively implemented 2 strategies. So I'm just really, again, proud of all of us for kind of showing up in this space and doing the work in person and virtually, and really acknowledging all the good work that's been happening. Next slide. And just to kind of say, again, this timeline again changes every time, but we started, as I said, in the fall, and we have sort of working through designing this as we've gone along. So again, doing communities of practices, doing convenings, working with stakeholders to get their perspective on how the strategies would shape out, and really leaning into what the strategy would look like and how it would, sort of come into play. Next slide. And then in the fall, so far, we've done 2 communities of practices, and coming soon, we're going to do more and more as time goes on. Thanks. So I can't believe it, but we 10 of these. We've done 10 Camusa practices since we started in 2023. Really, again, huge thank you to everyone who made this possible. Put an emoji about how this feels. If it's your first one, welcome. If it's your 10th one, amazing. Look at what we've done together. So just acknowledging your commitment, insights, and collaboration keep this space thriving. And I'm going to welcome everyone if you all can come on video, if you're comfortable, if we could just take a group picture to acknowledge this milestone.
All right, I'll be taking the group picture. Wait for folks to come up. And I'll count us down too. Alrighty. One, two, wait, sorry, people are moving. All right. One, two, three. Amazing. Thank you all.
Thanks so much, Stephanie. Bye. So the purpose and grounding of our community practice, I think that everyone's catching on. This is about engaging and resource sharing. And again, looking to the strategy as our North Star. It's about sharing ideas, resources, and our own lived experiences. I mean, everyone sort of seems personally touched by mental health and is doing this existing in their roles and responsibilities. So we like to say what we mean by community practice is we're a group of people with a shared interest who come together, exchange, and support. And it's not just meetings, it feels like. I mean, maybe it does feel like that sometimes, but it's really ongoing network of collaboration, reflection, and action. And we really have been thoughtful about how we're going to shape these to come. I think at the beginning, and it's just part of like how we started, we really leaned into the JED's comprehensive approach with which a lot of schools are using to kind of think about their strategy. But since so far, we've taken different pillars of the strategy we have implemented for the state and thought about what are the topics that are on the minds and where are the resources needed. So the last time we focused on student voice, it was incredible to hear a panel of students talking about what their needs are and what are the current concerns around climate and how we might help them. So today our focus will really shift to substance misuse and recovery, again, part of an extension of our strategy, and highlight the good resources that are out there. So again, and thanks for being here, and I'll kick it off to our guest speakers.
Actually, I'll kick it off to Ashley to introduce our guest speakers.
Great, thank you.
Yeah.
Good afternoon, everyone. Thank you for joining us. I will super quickly introduce our speakers for the next little bit. I'm excited because I've gotten the chance, along with Stephanie and Erica, to have some great conversations with these ladies. So I'm super excited for them to share with you guys today. First to speak will be Mary Jackson, who is a senior associate in the Workforce and Economic Development Unit at the Council on Post-Secondary Education, CPE for short, for those that are new here today, where she develops strategies to address critical workforce challenges across multiple sectors and to close opportunity gaps, those particularly for college students nearing their end of their reign or just right after graduation, as well as individuals from underrepresented populations. She also leads CPE Career Development Officers, CDO Affinity Group, which is the first of its kind at the council, which utilizes career services and workforce development for professionals from colleges and universities across the state. With more than 19 years of experience in higher education, Mary has served in a variety of roles spanning both faculty and administration. She has earned her bachelor's degree from Berea College and has her master's from Eastern Kentucky University. Beyond her work in education, Mary is also a professional singer and is passionate about mentoring young people, dedicating her time to empowering the next generation. And shortly after we hear Mary speak, we will hear Dr. Whitney Harper, who is a licensed clinical social worker. Whitney has been a licensed clinical social worker for over 25 years. She has graduated from Grand Valley State University with her master's in social work in 1998 and received her PhD in human development and family studies from Michigan State University in 2015. With 20 years of experience in the field of substance use and trauma-focused treatment, Whitney is a certified acupuncture detoxification specialist and fully embraces a holistic approach to recovery. Additionally, she specializes in working with adolescents and young adults addressing issues with codependency, depression, and anxiety. Whitney values an inclusive environment and provides safe spaces for our BIPOC and LGBTQ communities. As an associate professor at Western Kentucky University in social work department, Whitney has published research in the field of addiction and trauma. She provides continuing education trainings to clinical social workers on topics such as opioid epidemic, co occurring disorders, intimate partner violence, sexual orientation, and gender identification and substance use. If you could please give me a virtual round of applause for our guest speakers here today.
Thank you so much for that lovely introduction, Ashley. I appreciate it. I think someone put in the chat, I did not know you were a professional singer. That's so cool. Yes, I am. I think I would say probably some of the coolest gigs I've had the past few years is I actually sang at the governor's inauguration, and I toured in Switzerland last fall. So needless to say, I would rather be experiencing fall right now in Switzerland than Kentucky, but hey, here we are. Here we are. So good afternoon, everyone. Again, my name is Mary Jackson, and I serve as as a senior associate in the Workforce and Economic Development Unit at the Kentucky Council on Post-Secondary Education. Thanks so much for taking the time to be here today, and I'm going to share a little bit about the Collegiate Recovery Resource Centers, also known as CRRCs. This is a subject that's both pretty timely and deeply important, not only for higher education, but for the health and future of our students, our campuses, and our communities here in Kentucky. So over the next few minutes, I'm going to touch on 3 key areas: what CRRCs are, why they matter, and the goals and impact we're working towards. Next slide. So what are CRRCs? Collegiate Recovery Resource Centers are a dedicated supportive spaces on our campus that serve students in recovery from substance use disorder or some sort of co-occurring mental health challenge. And these centers are, most of the centers are trauma informed, meaning that the services are designed to meet students where they are and to create a safe, welcoming, non-judgmental environment. But CRRCs are more than just a location or a program. They represent a commitment from the campus. They're communities where students find acceptance, they find encouragement, and they find belonging. Because this is a really sensitive time, you know, being a college student. So, you know, you want to make sure that the community that you provide in this sort of environment is, of course, encouraging and accepting. And of course, you know, they want to belong, find a sense of belonging. And I'll give you a quick example. A CRRC might host a drop-in peer support group, or offer access to professional counseling, or provide workshops on managing stress and time. They can also connect students to mentors who understand what it's like to walk on their particular path or that particular path. Also, the CRRCs, sorry, my computer just glitched a little bit. Can you all hear me? Okay, good. So examples, like another example is that CRRCs might provide, like I said, a drop-in peer support group and access to professional counseling. They can also offer mentorship connections, because we all know that peer-to-peer, you know, counseling and mentorship definitely works in all facets of education. And plus, it helps students feel less isolated And importantly, these centers reinforce messaging that recovery is possible, that education is attainable, and that students are not alone in their journey. Next slide. So why does this matter so much? So first of all, CRRCs align directly with the Kentucky Opioid Abatement Advisory Commission statewide goals to combat the opioid epidemic. And that's actually where this grant comes from, is from the Kentucky Opioid Abatement Advisory Commission office. The opioid crisis, as you all well know, has touched nearly every community in Kentucky. And our campuses are not immune. By creating recovery-ready campuses, we're aligning higher education with Kentucky's broader public health and recovery strategy. Secondly, I would say CRRCs create a safer and more supportive learning environment. When campuses are recovery-ready, they send a message to the students that, that in recovery, they're still valued members of the community. This increases retention, persistence, and graduation rates because students feel supported in their journey. CRRCs also provide access to these CRRCs provide access to essential services, and these include peer support and mentorship, so students can learn from others. I talked about that earlier. Mental health counseling services addressing not only addiction, but the co-occurring mental health challenges, and housing stability and pathways back to school and work. Because we all know that recovery often requires stability in every aspect of life. And, we have to kind of look at those things as well. So kind of think about the impact of these supports. A student might otherwise leave school, right? To relapse or to relapse or kind of fall for the stigma. And through the CRRCs, they now have a supportive network and concrete resources to stay on track. And that's pretty life-changing. In many cases, it's also life-saving. Next slide. So this slide, we're going to talk about our goals and impact. So what are our goals with the CRRC initiative, and what kind of impact do we hope to see? We want to expand campus recovery resources through community partnerships. I can't tell you enough how important community partnerships are in this effort to assist students on campuses in recovery. So no campus can tackle the challenges alone, and by working with local organizations and treatment providers and recovery groups, CRRCs can create a strong network of support for students. Secondly, CRRCs aim to reduce stigma. Stigma is definitely a pretty strong barrier to recovery, and a lot of students are very concerned about their reputation and how they're seen to others in college, and just particularly older teens and young adults in this particular age. So through education and awareness programs, CRRCs work to shift the campus culture so that instead of judgment or misunderstanding, students encounter compassion instead. Compassion, support, just love in general. Third, we're committed to evaluation and impact measurement. We want to make sure that we track outcomes like student retention, academic performance, and well-being. So this data is not only necessary for accountability, but it's also how we demonstrate that CRRCs make a measurable difference. And finally, our goal is sustainability. We don't want CRRCs to be some sort of short-lived project tied to a single grant. We want them to be integral, long-term parts of the campuses across the state. Places where students know that they can count on this particular area of support for years to come. So the ultimate measure of the success with this is the more students in recovery complete their degrees and transition successfully into the workforce, they can have a more fulfilling lives. And that's the kind of impact and change that we want to see, not just on individual futures, but the trajectory of families and communities and those who are supporting individuals that are trying to make it out of their struggle so that they can go on to live very fulfilling lives and contribute in a meaningful way to our society. So I'm going to turn, before I turn it over to Dr. Harper, I want to emphasize a particular point. So CRRCs are more than just a service. They're about people. And I talked about that earlier, but I want to emphasize it. It's about making sure that students in recovery, kind of feel like they belong and that they're capable and, that their future is worth investing in. So I'm going to turn the next part of the presentation over to Dr. Whitney Harper from Western Kentucky University. And she's going to talk a little bit about what they're doing in terms of starting their CRRC and some other key nuggets I think that you'll find helpful.
Next slide. Yeah. Hi, everyone. I'm glad to be here and share how we are establishing a CRRC. We have a wellness experience program. And so when we looked at the grant, looking at, okay, well, how could we make this sustainable? How could we make a CRRC embedded in something we already do? Because we know that this funding doesn't last forever. And so we started a wellness experience in the College of Health and Human Services about 4 years ago. And it's staffed with 2 wellness navigators, and they have their master's in social work. And their role was to reach out to students that are in a health or similar services type of degree and help them establish more of a life balance, self-care, being able to manage everything at school, everything at home, everything at work. And so we thought this would be a great place for the CRRC to settle in. Is the 10 dimensions of wellness fits perfectly with a model of just mental health wellness, let alone substance misuse treatment. So it is housed in our wellness experience. We have an office. We have a study space where students can come, bring their laptop, have some snacks, get a quiet place to study. So in our CRRC, our services include all the wellness experience services, which I'll discuss more in the next slide. We have, it's more of an assessment and referral type of service where students can sit down with a wellness navigator, go through the assessment process to refer to a couple of different substance use agencies in our community. So we have partnered with Life Skills and JourneyPeer, and we are collecting information that they would need for an intake, if you will, to determine what level of care best meets this student's need. I also trained both navigators in SBIRT, which is a screening brief referral to treatment, which involves trauma-informed kind of modality, motivational interviewing, doing the screening for a DAST, a CRAFT, an audit, as well as any presenting problems that would connect what they're experiencing now with maybe a referral. And both JourneyPeer and Life Skills have everything from outpatient to detox to intensive outpatient and residential. So they cover all levels of care. Students that are interested can also receive through the funding through our CPE grant is taking the course. It's 1 credit. It's called Enhancing Quality of Life for Health and Human Service Professionals. So just a 1-credit course that goes through the 10 dimensions of wellness and how to balance to receive more quality in your life. We also have assigned to every student that's seeking CRRC services a recovery support academic advisor, which is me. I will help them through any major. It doesn't need to be within the CHHS. That can be any trade type of degree, all the way to any other BS type of degree. We also have NAMI on our campus, which is the national support group for anyone struggling with a mental health issue. And so we're going to make sure that all students who come through the CRRC are aware of our NAMI meetings. And then just as a side, I developed a substance use disorder certificate with Western Kentucky that meets the educational requirements for the Kentucky Board of Alcohol and Drug Counselors. And many times I have seen in our department, for sure, of social work, that students that are in recovery want to work in that field. And so this substance use disorder certificate will definitely help them to be a peer recovery support specialist, all the way to, if they receive their bachelor's degree, they'll be a certified addiction drug counselor. Our partners on campus, super important. We are definitely partners with the counseling department. I'm in the process right now of developing marketing materials, a QR link. We have a website now where they can, students that are maybe in the waiting room can see some of this material, but all the counselors are also educated about the CRRC and what we do and all of the services, so they can refer. I'm the Associate Dean of Student Life is on our committee, and her name is Dr. Martha Sales, and she's helping us connect to different student life activities, ways we can host workshops and invite more students that are on campus. And I haven't yet connected with, but want to connect to our athletic department. We know many stories where students had received an injury, they've got a prescription for an opioid, and they had developed a dependency on that medication. And so this is a really great resource to reach students that might be struggling in that area. And we also have a medical center on our campus, and talking with the director of the medical center in case anyone comes in any symptoms of use or OD, so we can make sure that we can connect them to our services. And like I said, in the community, we are partnering with Life Skills and Journey Peer. And next slide. So our strategic plan for student engagement, as I said, we haven't served any students yet. We're establishing the center right now. But what we will already have in store for any students that have come to the CRRC is that they will have wellness check-ins. So regardless if they want to do an assessment, they're committed to doing some form of treatment. Let's say they're not ready for that. They're just getting some information. They will be included in all the wellness check-ins that our navigators do. Those check-ins are through email. Those check-ins are in a group format, workshops, all different ways that our wellness navigators reach students. We want to make sure there's a no wrong door approach, and anyone out there that are co-occurring experts, or your focus has been with co-occurring disorders, you know that that's like a primary strategy, is that whether you have a mental illness or a substance use issue, it doesn't matter where you go, there's no wrong door. It's not oh, well, I'm sorry, we don't work with mental ill health, we don't work with substance use, you need to go somewhere else, which is how it was when I first started in the early 90s, where substance use treatment and mental health treatment were very separate. So we want to make sure that the students don't feel like they may not fit in coming to our wellness experience, CRRC. Of course, the advising, I will be hosting focus groups. I will have workshops. I do different presentations for different disciplines across campus. So I will continue to do that and add that we have a CRRC. I developed with the counseling department a mental health portal through Blackboard a long time ago, and we will be utilizing this portal. It's a way students can just sit in their room and go through either a depression, anxiety, or substance use assessment. And we have videos of college students that have experienced any of these issues. We have a self-assessment where they can click and find a score with the PHQ or the generalized anxiety disorder or a DAST or an audit, and they can see the results and what the recommendations would be and get resources that are in our community. I'll be hosting 2 focus groups. And then marketing, I just hot off the press have they're called reference cards, and they are in hard stock paper, and they're front and back, and they have the QR code for our website. So we are going to distribute those across campus, and they kind of fit like in a referral card rack or something like that. They can be easily passed out. We have the website. We're still kind of working on it, but we have links to other services across activities across campus, services in the community, as well as dictating and identifying like all the services we offer at the CRRC. Because of the wellness experience, we already have wellness booths. We have them at homecoming, football games, different events that we have on campus. So the wellness booth will definitely be also communicating all of the great services through the CRRC, and then doing the presentations to the different departments and faculty. I had just got published an article with my team at Western Kentucky. It's called Wellness and Capacity, Are Classroom Faculty Equipped to Help Student with Mental Health Concerns? And we surveyed over 500 students on campus if they felt their faculty were prepared in dealing with the mental health, trauma, substance use issues that were impacting them in the classroom. And remarkably, they felt like the faculty had a willingness, but not necessarily the capacity to help. And so that is really going to be the target of these presentations, is equipping faculty with the capacity to provide more relevant, helpful, effective type of interventions. And I think that's the end of my slides.
So does anyone have any questions? I think I saw one in the chat where it says you may be about to address this, but do you all include disordered eating disorders with the broader scope of the CRRC services? That is going to be a yes through the no wrong door approach that Dr. Harper discussed, but also it includes co-occurring co-occurring challenges. So if there's a particular challenge that's co-occurring with substance use disorder, then the CRRC will assist with getting treatment for that.
We do have a raised hand.
Dr. Bureau, hello.
Hey, how are you? Whitney, can you explain more about this last point you were making around capacity building for faculty? I can see competence or skill sets, but capacity, I wonder how that's being enacted.
Glad you asked. Okay, so Firestone developed the model Wellness and Capacity in Education in 1989, and we used that model to determine if faculty had both the willness and capacity to work with students that, let's say, they're missing class, they have excessive late papers, they're noticing a deterioration in their academic performance. Willness is when a student might reach out, send an email. I'm really struggling right now. Can I have an extension on my paper? Or here's an explanation of why I'm absent. And so the student came to them and stated that they had a mental health concern or crisis. What was the response of the faculty? And this is kind of what the survey was asking. And it was a mixed method. We had quantitative and qualitative. And what faculty were saying is if a student reaches out, some would give an extension. Some would even go, hey, contact the counseling department. Here's the number. I think that would be a really great idea. So that was like willingness. Capacity was when the faculty were proactive in identifying that students might be struggling. They're recognizing that they're delayed in turning in assignments or not at all, or their performance was declining, and they reach out and they are like, let's schedule a meeting, let's do a Zoom, let's do a phone call, come into my office hours, let's really break this down. Who are your supports? What intervention can there be? Let me do a warm handoff to counseling center right now. Let me call them and see if there's someone available, and I'll walk you over there. Or understanding a little bit about insurance and payment and knowing what community resources they have. Can they go to the med center that's on campus and get a direct referral? Like just more of a capacity of understanding what actually is available to students and then directly connecting them maybe before they drop out or drop off. So that capacity piece of having more of your thumb on the pulse of your classroom and the students in the classroom, and the willness behind wanting to do those things too. I hope that answers your question.
It does. Thank you.
Are there any other questions? If anyone feels free to come off mic. I know we did the Mentimeter in the beginning, so I'm happy to go back to those questions, but I wanted to see if anyone had another question they'd like to ask. If not, okay, I will go back to Mentimeter and just some general questions that folks had put in the chat. Mary or Whitney, please feel free to answer. Someone had written, what risk factors are being addressed to prevent substance misuse? I'll read them all so we don't have to go back and forth. What protective factors are being implemented? I'm curious to hear what other universities are doing. Interested in finding out what is considered best practice in higher education. And the last question, how can this topic be more of a collaborative effort on the college campuses? And if I need to go back at all to reread the questions, just let me know as well.
I love the question about not just risk factors, but protective factors. Oh gosh, if that's where our focus was from, birth, boy, we might be in a different position. But I believe the wellness experience is built on protective factors. So whether you have a presenting issue in mental health or substance use, what we do in the College of Health and Human Services is anyone who is a major in a discipline in that college has the wellness navigator connection. So whether they sought it out or not, they're going to get the emails, the social media, the classroom presentations about the wellness experience. So any student in the College of Health and Human Sciences already knows about the courses. They have 4 different courses that they teach. They're all just 1 credit. So any student has that accessible to them to just take this course, which teaches about the 10 dimensions of wellness. And the wellness navigators, they during their check-ins or their email or their social media, what they're doing is they're advertising activities that are on campus. Come join us. We're doing bring a brown bag, and we're just going to talk about different clubs and organizations. They help students find their niche on campus so they don't feel lost, especially first-generation college students. Another, I think, proactive factor is we have a first generation experience now. This is coming straight from our president, where if you're a first generation college student, you get a mentor. And the faculty sign up as mentors. And I am, of course, a mentor. I'm first gen. And so we meet with students once a month, going through all different types of academic advising, connecting them to different clubs and organizations, helping them find their niche so they don't feel lost. I remember there's studies that are still true to this day that a first gen might change their major 6 times. That's how lost and confused they are. And I remember my mom, go into marketing. That's how you make money. I didn't care about marketing, but my mom never went to college. She just wanted me to make money, right? Going to college costs money. So the first gen program, I think, is another great proactive measure to kind of get students right when they're on campus and when they're feeling maybe the most vulnerable, and supporting them. Does anyone out there have any experiences where they feel they have some protective factors on campus? Would love to hear any experiences that you're having.
I don't hear anyone answering your question. So there's another question that I'm just gonna take a little time and just say a little bit, because I know that we need to move on, about how can this topic be more of a collaborative effort on college campuses. I will say this from working with a lot of administrators over the years, you can always get their attention with a story that you can prove, stories and situations that you can prove through data. So if you're able to gather together some data that proves that this is something that needs to be a priority, and then draw up a good story and be really persuasive. And again, I can't emphasize enough about the data portion of it. You'll get their attention, particularly because retention is really important to administrators. Persistence, retention, graduation is really important. So anything that gets the students where they can retain the student, for the student to persist and graduate, they're going to be interested in it.
Thank you for that. If we could give another virtual round of applause to our presenters today, I think you shared a lot of great nuggets for folks to take away. And please know that at any time in your processes to your campuses, if there's something that you can take back or reach back out to, I think our speakers' contact information is on at the end of the slide, so we'll be sure to share that. But I'll pass it back to you, Stephanie.
Yes. Now we'll move into community-based resource sharing. I'll pass it off to Erica to lead us into this final section.
Thanks, Stephanie. And thank you so much, Whitney and Mary. I learned so much. It's so great to have CRRC, and we're similar in our approach with the schools and our program. Just thinking about screening, assessment, support groups, treatment, referrals. What does belonging look like? The role of mentorship and trauma informed. I really appreciated those bullet points. And again, no wrong door. We're on the same page there. So thank you for being here and sharing about this wonderful resource. So I'm going to go through a few examples of what the schools in our program have sort of implemented in their time with us, and just it's about the resource, it's about shaping it with the student experience, it's about the look and feel, and again about connecting people to support. So while I share some resources, I really invite all of you to look at sort of what exists on your campus or your community, and share in the chat if you have something similar, so that we can ultimately build a resource bank of all these examples and pull and borrow and as we need. So next slide. So definitely use the chat as I share. So some campus and national models. So UNC Greensboro, again, similar to the resources we just learned a little bit about, but is a peer support community for students in all phases of recovery. There's a recovery lounge, there's a connection for campus life. At Kennesaw State, there's a Center for Young Adult Addiction and Recovery. It combines peer recovery support, research, collegiate recovery programs and communities. This is a national directory of what exists. There's framework for consistent support and recovery. Boise State, there's the Office of Recovery and Louisville Center, which are centralized hubs. So again, centralizing, knowing where students can go on campus. I mean, a lot of this exists already, but just kind of see examples and how you can find these resources on a campus, where they are, like what kind of department they're under, who's staffing the, etc. And these programs really illustrate, again, no wrong door, recovery and well-being, how it's embedded, and it's dedicated space and structured supports. So we'll link these in the PowerPoint slides for when we send them out. And these are just some good examples. Next slide. And then some other community-based resource sharing. Wake Forest Game Day Memories, another school in our program, promotes mindful celebration, safe tailgating, defining and redefining social norms around game day drinking. UVM, University of Vermont Tea Break Guide. I remember they had created that many, many years ago while in our program, but structured cannabis tolerance break, encouraging reflection and balance. Penn State Basics, as many of you use, the brief alcohol screening intervention tool for identifying student at risk. And for Boston College and James Madison University, again, coaching, alcohol education programs. And so the key takeaway for all of this is harm reduction, early intervention, and shifting social norms. And there's just so many examples out there that we can lean on. And I invite folks, and again, on Zoom right now, if you have examples that you want to share with us, that you feel should get on this list for future efforts, please do share them with the group. Thank you.
All right, well, folks, do that. We'll move on to wrapping up. Again, a huge thank you. Oh, looks like we have some in the chat from Kate. Thank you so much, Kate. I'll be sure to add that into our bank. Thank you again to our speakers, Dr. Harper and Whitney. Dr. Harper and Mary, apologies. We really appreciated hearing from you and your willingness to answer our questions and follow up. Please fill out the post survey. I'll go ahead and put that in our chat. And if any questions arise, we have our contact information here. Yeah, Ashley, anything to wrap us up?
No, but just to save the date, I think we have one more community of practice in about a month. And we'll touch on the topic faculty and staff training. So if there's something again that you'd like to hear or see or speak about, please feel free to reach out. I think there's a section in the post survey that you can do. And we do hope that you've taken something away today that will inspire you to do the work on your campuses for your students and ultimately help them be successful within their journey of post-secondary education. So thank you for joining us today. And I know tomorrow is Halloween, so I hope you get lots of candy and have a great time. So thank you. Happy Thursday.
Thank you, everyone.
Stephanie, have you ever thought of doing radio?
Oh,
You
no.
have the voice.
Oh, thank you.
Very soothing.
It
I felt that.
is. Oh my gosh. Who is that woman?